Schizoid personality disorder. People with schizoid personality disorder, or SPD, are considered to be loners with a deep inability to connect with others. They may appear odd or peculiar to others. They do not form close relationships or friendships, and they are perceived as distant, unconcerned, and socially unengaged. They generally prefer to do things on their own and rarely express any strong emotion. Although they may have some similar symptoms, SPD is not the same thing as schizophrenia. Many people with SPD are able to function fairly well, although they tend to choose jobs that allow them to work alone, such as night security officers, librarian, or lab work. People with SPD prefer to be by themselves, organising their lives to avoid contact with other people. Many never marry or continue to live with their parents as adults. Those that do marry may well have trouble having a close relationship with their spouses. Other common traits of people with this disorder include the following. They do not desire or enjoy close relationships, even with family members. They have difficulty relating to others. They don't care about praise or criticism. They choose solitary jobs and activities. They take pleasure in few activities, including sex. They have no close friends outside of their close family members. They show little emotion. They may daydream and/or create fantasies of complex inner lives. It is difficult to accurately determine how common this disorder is, because people with SPD rarely seek treatment. The disorder affects males more than females, and is more common in people who have close relatives who have been diagnosed with schizophrenia. SPD usually begins in late adolescence or early adulthood. There is no known way to prevent this disorder. Causes of SPD. Little is known about the cause of SPD, but it is generally agreed that both genetics and environment are factors. Some professionals say that it is a difficult childhood with little warmth and emotion that will contribute to its development. The higher risk of SPD in families of schizophrenics suggests that there is a genetic susceptibility for the disorder. Furthermore, childhood mental trauma, including physical or sexual abuse, an unstable family life as a child, or severe loss, such as death of family members, results in a higher risk of development of SPD. Diagnosis of schizoid personality disorder. Like all illnesses, the diagnosis of SPD should be made by a mental health professional. If symptoms of this disorder are present, the doctor will conduct an evaluation by assessing medical history and performing a physical exam. Although there are no lab tests to specifically diagnose this disorder, the doctor might conduct various tests in order to rule out physical illness as the cause of the symptoms. If the doctor finds no physical issues, he or she might refer the person to a psychiatrist or psychologist, as they are specifically trained to diagnose and treat mental illnesses. They use specially designed interview and assessment tools to evaluate a person for a personality disorder. The diagnosis is based on characteristics and behaviours such as those listed previously. These characteristics must not co-occur with other symptoms of schizophrenia to meet the criteria for SPD. Treatment of SPD. People with this disorder rarely seek treatment because their thoughts and behaviour generally do not cause them any distress. When treatment is sought, psychotherapy is generally the form of treatment used. Treatment tends to focus on increasing general coping skills, improving ability to interact socially, improve communication, and boost self-esteem. Because trust is an important component of therapy, treatment can be challenging for the therapist because people with SPD have difficulty in forming relationships with others. A person with SPD usually has a very shallow social network due to their desire to be alone. Family and friends need to educate themselves about SPD in order to learn how to help the person connect with their support structure. Family members will help a person with SPD to enter a treatment facility by providing emotional and financial support. Medication is not generally used to treat SPD. However, drugs might be prescribed if the person also suffers from another psychological problem such as depression. Social impacts of SPD. As a general lack of social interaction is the main complication of SPD, people with this disorder are rarely violent as they prefer not to interact with people. Although some of their behaviours might appear to be strange, people with SPD are generally able to function adequately in everyday life. However, they might not form any meaningful relationships or have families of their own. Prognosis of schizoid personality disorder. SPD is a lifelong personality disturbance with periods where the condition worsens and improves depending on life circumstances. Research shows that long-term psychotherapy, sleep and stress management, and education can significantly improve the functioning of someone with this disorder. People with SPD may also be predisposed to other conditions, including depression, anxiety, or substance abuse, which can make treatment more difficult. Another issue preventing effective treatment is that they usually do not want to undertake any treatment. They may enter treatment only in a time of crisis and stay until it is resolved and then discontinue treatment. They may sabotage the therapy in order to return to their secluded lives. They may also be isolated from their family or loved ones and therefore lack an effective social support structure. When a person with SPD is having serious issues that adversely impact their daily school or work life and personal and family relationships, an intensive treatment program is an appropriate option. When they're having a crisis period in their life, it is often a good time to get them to start a treatment plan.